Back pain in the elderly is a complex problem that greatly affects the quality of life. Below is a more detailed explanation of the causes of back pain, including physiological mechanisms, risk factors, and specific remedies, presented more clearly and comprehensively. Causes of spinal pain in the elderly. 1. Degenerative disc disease mechanism. The discs between the vertebrae, mainly cartilage and connective tissue, lose water and elasticity over time due to aging. This reduces the disc's ability to absorb force, putting pressure on the surrounding joints and ligaments. At the same time, the facet joints wear out, leading to inflammation and the formation of bone spurs, osteophytes. Risk factors: age, usually 50 or older, heavy work, prolonged poor posture, or repetitive trauma. Symptoms: dull or severe pain in the lumbar region or neck, often increased by sitting for long periods, bending, turning, or lifting heavy objects. May be accompanied by morning stiffness. Affected area usually occurs in the lumbar spine, L for L5, L5S1, or neck, C5C7. 2. Osteoporosis mechanism. Bone density decreases due to an imbalance between bone formation and bone resorption, making bones brittle and susceptible to fracture. In the spine, microfractures or vertebral compression fractures occur, causing acute or chronic pain. Risk factors: postmenopausal women due to decreased estrogen, calcium, vitamin D deficiency, lack of exercise, smoking, heavy alcohol consumption, or long-term use of corticosteroids. Symptoms: sudden back pain, usually in the thoracic or lumbar region. Loss of height due to vertebral collapse, kyphosis. Sometimes there are no obvious symptoms until a fracture occurs. Consequences: can lead to spinal deformity or limited mobility. 3. Herniated disc mechanism. The outer cartilage ring of the disc, annulus fibrosus, is torn. The nucleus pulposus escapes, compressing the nerve roots or spinal cord. In the elderly, the disc has degenerated and is more vulnerable to damage when subjected to force. Risk factors: lifting heavy objects incorrectly, obesity, or repetitive trauma. Symptoms: pain radiating from the back down the legs, sciatica, or from the neck down the arms, accompanied by numbness and muscle weakness. Pain often increases when coughing, sneezing, or sitting for a long time. Affected area usually occurs in the lumbar spine, L for L5, L5S1, or neck, C5C6. 4. Spinal stenosis mechanism. The spinal canal or foramen, where the nerve roots pass, narrows due to bone spurs, bulging discs, or thickened ligaments due to degeneration. This causes compression of the nerve or spinal cord. Risk factors: old age, spinal degeneration, or old injury. Symptoms: back or neck pain, numbness, weakness in the limbs, pain that increases when standing or walking, neurogenic. Claudication: resting or bending forward may relieve the pain. Affected area: mainly in the lumbar spine or neck. 5. Spondylosis or osteoarthritis mechanism. Cartilage in the facet joints wears away, leading to friction between the bones, causing inflammation and pain. Bone spurs can also form, limiting movement. Risk factors: age, obesity, poor posture, or genetics. Symptoms: stiffness, especially in the morning or after long periods of rest. Reduced spinal flexibility. Pain may radiate to the buttocks or thighs. Affected area usually occurs in the lumbar spine or neck. 6. Posture and lifestyle mechanism. Sitting in the wrong posture, lack of exercise, or long-term heavy work causes muscle and ligament tension and uneven pressure on the spine. Weak back and abdominal muscles lose their ability to support the spine. Risk factors: sedentary lifestyle, obesity, or prolonged office work. Symptoms: dull pain. Increases when maintaining a position for a long time. Sitting, standing, decreases when changing position. 7. Underlying illness or old injury mechanism. Diseases such as ankylosing spondylitis, rheumatoid arthritis, or old injuries. Accidents, falls damage the spinal structures, leading to chronic pain. Risk factors: history of trauma, autoimmune disease, or infection. Symptoms: persistent pain, stiffness, reduced mobility, sometimes accompanied by fever or swelling if there is inflammation. 8. Psychological factors. Mechanism: stress, anxiety, or depression increase sensitivity to pain through neurological mechanisms. Increased pain signals in the brain. Muscle contraction due to stress also contributes to back pain. Risk factors: work pressure, insomnia, or psychological disorders. Symptoms: pain of unknown origin, often accompanied by fatigue and difficulty concentrating. How to overcome spinal pain. 1. Medical treatment. Medicine: pain relief, paracetamol, or non-steroidal anti-inflammatory drugs and NSAIDs such as ibuprofen, diclofenac help relieve pain and inflammation. Use as directed by your doctor to avoid side effects: stomach pain, liver, kidney damage. Muscle relaxants, used when there is muscle spasms such as cyclobenzaprine. Neurologic medications: gabapentin or pregabalin for nerve compression pain. Corticosteroids, epidural injection or short-term oral administration to reduce severe inflammation. Surgery. Indications: severe disc herniation causing limb weakness, severe spinal stenosis, or vertebral compression fractures that do not improve. Treatments include discectomy, artificial disc replacement, or spinal fusion. Risks: infection, nerve damage, or pain recurrence. Injection: epidural steroid injections to reduce inflammation and sciatica pain. The effects last for several weeks to several months. Facet joint injection to relieve pain from arthritis. 2. Physical therapy and rehabilitation. Physical therapy exercises strengthen core muscles. Exercise such as plank, bridge, or cat-cow help support the spine. Stretching, yoga movements, child's pose, cobra pose, or lumbar stretching help reduce pressure on the discs. Increase range of motion. Neck rotation exercises and gentle body tilts improve flexibility. Note: this should be done under expert guidance to avoid further damage. Acupuncture. Stimulating acupuncture points with thin needles helps relieve pain and improve blood circulation. Massage. Relieves muscle tension, improves circulation. Suitable for pain caused by stress or poor posture. Chiropractic. A chiropractor adjusts the structure of the spine, relieving pressure on the nerves. Should only be performed by a certified person. 3. Change your lifestyle. Correct posture. Sitting. Use a chair with a backrest. Keep your back straight, feet touching the floor, knees at a 90-degree angle. Standing. Distribute weight evenly on both feet. Do not hunch over. Lifting heavy objects. Bend at the knees instead of the back. Keep the object close to the body. Exercise regularly. Swimming reduces pressure on the spine. Strengthens muscles throughout the body. Walking 30 minutes a day improves circulation and muscle strength. Yoga or Pilates strengthens core muscles, improves posture, reduces pain. Avoid high-impact activities such as jogging or heavy weight lifting. Weight control. Lose weight if overweight through diet and exercise, as obesity increases pressure on the lumbar spine. Sleep properly. Mattress. Choose a medium firm mattress, not too soft to support the spine. Position. Lie on your back with a pillow under your knees or lie on your side with a pillow between your legs to maintain the natural curve of your spine. Quit bad habits. Limit smoking, which reduces blood flow to the discs, and drinking alcohol, which increases inflammation. 4. Nutrition. Calcium and vitamin D supplements. Calcium 1,000 to 1,200 milligrams per day. Milk, yogurt, cheese, green vegetables, spinach, kale, salmon, or supplements. Vitamin D 800 1,000 IU. Day. Fatty fish, egg yolks, or sunlight 15 to 30 minutes per day. Anti-inflammatory foods. Omega-3, salmon, mackerel, walnuts, chia seeds, fruits and vegetables, strawberries, blueberries, broccoli, spinach. Limit processed foods, sugar, and saturated fats. Drink enough water. Keep the discs hydrated, reducing the risk of degeneration. 5. Device support. Back brace supports the spine during heavy work or during acute pain, but should not be used long-term to avoid muscle weakness. Appropriate footwear. Shoes with arch support soles reduce pressure on the spine when walking or standing for long periods of time. Orthopedic pillow. A pillow that supports the neck or lumbar area while sitting or sleeping. 6. Psychological management. Stress reduction, meditation, deep breathing, or relaxing activities such as reading or listening to music. Psychological support. If pain is related to depression or anxiety, psychological counseling or cognitive behavioral therapy, CBT may be needed. Get enough sleep. Lack of sleep increases the feeling of pain. Maintain 7 to 8 hours of sleep each night. 7. Monitoring and prevention of recurrence. Regular checkups. Bone health check. DEXA bone density me. Measurement and spine with a specialist musculoskeletal neurologist. Diagnostic imaging. X-ray, MRI, or CT to assess the extent of damage. Degeneration, herniation, spinal stenosis. Prevention. Avoid activities that put a lot of pressure on the spine. Maintain a healthy lifestyle and adhere to treatment. Important note: seek medical help if back pain lasts longer than 6 weeks, is accompanied by numbness, weakness, or severe symptoms, loss of bladder control, fever, unexplained weight loss. Seek medical attention immediately to rule out serious conditions such as cancer, infection, or spinal cord compression. Individualized treatment. Each person has different causes and levels of pain. Work with your doctor and physical therapist to develop an appropriate treatment plan. Be patient. Chronic back pain takes time to improve. A combination of treatments, medical, physical therapy, lifestyle will yield better results.